Hey, thank you so much for having me. It's a pleasure to be able to join in community on this Earth Day. I wish we could party in person, but this is excellent as well. So really a pleasure to be coming after an excellent presentation on planetary health. So I'll switch my framing up a little bit. And really, that's what it's in many cases about. It's about helping people to change their frame of reference. So I have been lucky to do much of my learning about this here in Yellowknives Dene territory. I have lived here for almost 10 years now and came to the north first about 15 years ago. And this is actually a picture I took flying between Inuvik and Aklavik, north of the Arctic Circle. So this part of the world is already 3 degrees Celsius warmer than it was when when an elder was born. This is the junction of Inuvialuit, Gwich'in, and Dene territory. And people in this region still really depend on food from the land for a large part of their lean protein. And so I actually happened to read the Lancet's 2009 Commission on Climate Change and Health, which has the very famous line that climate change is the biggest global health threat of the 21st century in the Inuvik hospital's nursing residents. And so instead of looking up from the paper and looking around and sort of talking about it with people who weren't impacted by climate change, I was talking about it with elders who said, yeah, it's actually way more dangerous to go out on the land now. We go through the ice. My brother, who's a very experienced land user, went through on the way to his trap line last year. And, you know, this is really making it difficult for us to see our friends and family in other flying communities. And this is having real impacts on our mental health. And so it sort of was one of these instances where what you read lines up with what you're hearing, lines up with what people are seeing. And in those situations, it's very easy to come to a diagnosis really quickly. And so I ended up joining the board of CAPE about just a couple of months later. And I've been engaged in this, between half and full time ever since. So we need to reframe our vision of health. And so when I went to school, I'm an emergency doctor. I really thought that health was generated inside the hospital. I think we had about 2 lectures on the social determinants of health the entire time. And what we now know, and this set of slides is in the supplement to this article, if anyone's interested in going to find them, is that really the ecological determinants of health, things like soil, water, the climate, form the necessary foundation for us to be able to build social and economic systems. And those give rise to the social determinants of health, things like housing and income, which have much greater impacts on overall health than what I do in the emergency department. Now, I'm still very proud of the work I do in the emerge. You know, if you get hit by a car, there is exactly one place you want to come. And so I'm glad that that's where I work. However, we really need to be very humble in terms of how much we contribute overall as physicians, because not only are the determinants of health based on stability in the layers that support the healthcare system, but our healthcare systems themselves depend on that stability. And that is something that is unfortunately very underappreciated. So I was actually just reviewing a global survey of climate change and planetary health education that the International Federation of Medical Students Associations put out in the last couple of years. Only 12 to 15% of medical students around the world are even learning about this right now. So it puts us in a position of having a lot of teaching and change making to do, all at a crux point. Because as we know, with COVID being a zoonotic virus that originated in animals, that intersection has been shown to be just incredibly important. So how do we take this information that we're reading about in journals, et cetera, and action it? So we've definitely, heard some groups already that are working on this, but I find it's helpful to just take this from the beginning. So I'm a very nerdy human and I love evidence. I've researched wildfires and menstrual cups, and I like getting to the bottom of what the best thing to do is. But the scientific and medical communities also have a bit of a bad habit of thinking that if we just sort of stick it in a journal article, someone's going to read it and do something about it, and it's magically going to happen in the world. So we've been working with an information deficit model of change making that just doesn't get the job done. And so the way I think about this now is, we need to change that data into policy that's appropriate to a given place at a given time. And then we need to do the work of movement building and influencing to try to get that evidence-based policy actually enacted in the real world. And I have been lucky to be involved in some of the local, national, and international movement building. And what is good to know is that it's growing, but the resources allocated to it and the time and attention allocated to it, particularly within the most powerful structures in health, so universities, journals, is still way, way, way lower than it needs to be. So CAPE I'm the past president of CAPE, and I've been on their board for over a decade now, and it's about time for me to get off. But once I'm done my past president role, I will sort of ride off into the sunset. When I first arrived there and I was very motivated about climate change, I was like, we need to solve climate change. And Gideon Foreman said to me, what's your target? So he now works for the David Suzuki's Foundation. He's a very experienced campaigner. And I was like, what do you mean target? Like, we need to tell the people the things. And he's like, Courtney, you need a target. And it turns out he's absolutely right. So what I like to talk about now is how we get things done. And so this is a model that's consistent with the movement building literature, Marshall Gans, et cetera, talking about really targeted change making. So the way I think about this is you choose a given thing you want to change that is evidence-based and strategic in your context, and you choose the most ambitious one that you feel like you can get done with the team of people you have at hand and the resources at your disposal. And we know that numbers numb and stories stick. And so you need to come up with a story to illustrate why that's a good idea. So for instance, in phasing out coal, we've often talked about how that will save children coming into the emergency department with asthma exacerbations, because that just tells you like how this is going to show up in people's actual lives. And that's what the climate communications tells us works best too. So framing climate change in terms of health and in terms particularly of the health and welfare of future generations and children tends to poll best across population segments. So that's one of the reasons why a planetary health frame, I think at this moment in time, is really helpful. So you use a variety of tactics to make that thing happen, whether it's op-eds, meeting with decision makers, polls, et cetera. And then when you win it, you get this really awesome burst of hope and empowerment that what I have actually found is the best way to build the team. When I first started doing this, I did a lot of telling people stuff. And then I just started trying to get people to do things with me. And that worked way better. So if I can save anybody who's new to this work a little bit of time, finding a project and getting people excited about doing that. And you're looking for a project that is ambitious enough that when people picture it, they get kind of sparkles in their eyes, because that's the thing that's going to get them off the couch. And so if you sort of pitch something and you're not seeing a sparkle, like usually the answer is actually to go more ambitious, because when people can picture that what you're doing is going to create a real meaningful change in the world, they get really excited. And so I often get asked, okay, well, what's the one thing I should do? And really the way I look at this is a ladder of engagement. So starting with a micro level, so a individual, or if you're a healthcare practitioner, provider level change, meso level, hospital community level change, macro level change, and then even a meta level change that can create social tipping points nationally or globally. It can be really helpful to just picture change happening in parallel at all of these different levels, because the one tends to reinforce the other. And so as we do this, the work itself and the community building that goes on with this can itself be extremely healing. What we like to talk about most is, or what I get most passionate about, is picturing ways that we can help health right now through the work that will also decrease greenhouse gas emissions. So these are things that have health co-benefits. So we know that anytime we decrease air pollution, we're going to decrease mortality from the top 5 chronic diseases currently killing Canadians. So cancer, stroke, heart disease, chronic lower respiratory disease, and diabetes. So those are really good ways to motivate decision makers. What we see from the Healthy Recovery Report that Kate put out is that if we meet our climate targets, via mechanisms that also decrease air pollution, we can save an estimated 112,000 lives between 2030 and 2050 from air pollution improvements alone. So we know that this report got a lot of play on Parliament Hill, and that's because people like to picture the concrete positive change that they can make. Now, This just came out today. And so we've been starting this planetary health movement. And it's one of these things that's so big and wide that sometimes the challenge is to be constantly moving between scales. So how do we move between this big nested scale and the concrete targeted changes? And we've been looking for ways to create a framework in terms of education that invites everybody in. So this was just published in the Lancet Planetary Health this morning for Earth Day. So the first time I presented it. And so it was a intercultural international group that helped to put this together. And so we're picturing this as a framework for planetary health education that can in fact be completely cross-disciplinary. So this would be something where you would picture people of all different disciplines in a room, all different backgrounds in a room, really coming together to figure out what they each bring to the planetary healing project currently at hand. And so the real arms of this that we've been looking at are the Anthropocene and its interconnections with human health, equity and social justice. So how do we make sure that we enhance equity and enhance justice, both because it's the right thing to do and also because it will enhance health. Systems thinking and complexity, because really this is not something that's going to work if we all stay in our silos. And really attending to movement building and systems change and thinking about interconnections within nature. So what we're doing is inviting everybody into this community. And sometimes the way we start this is by making a pledge, by setting an intention. So we wrote this and published it a couple months ago to invite people to consider themselves planetary healers. And you can take a look at this in the Lancet site. We've been asking different groups to go through it and holding fora for that. But I'll just read you the first line. I solemnly pledge to dedicate my life to the service of humanity and to the protection of natural systems on which human health depends. So this is a moment in time where we're experiencing the overlapping crises of COVID-19 and climate change. And we need all of us working on the planetary healing. And what I love about this is, I went to school for a tremendously long time to become a doctor. You can be a healer you just skip med school. As a great life choice. And there's still a tremendous amount to contribute, and we need your skill sets because we've all got our own cultural or disciplinary blind spots, and it's going to take all of us to come in to make sure that we create the equitable, just, and healthy world that we need. So thank you.